Tuberculosis is a very widespread disease in our part of the world, the tropics, especially rampant in Indonesia, Thailand and India. That's why our government, the Ministry of Health, mandates that workers from these countries be screened for tuberculosis via medical checkups and X-ray before being allowed to work here. Now, tuberculosis is a bacterial infection that mainly occurs in the lungs but may also happen in other parts of the body. It is caused by a few different strains of bacteria, but mainly the Mycobacterium tuberculosis and occasionally Mycobacterium bovis. Mycobacterium tuberculosis causes tuberculosis. That is quite easy to remember, right? So why the name myco in front of the bacterium, Mycobacterium? The prefix myco basically means fungi in Greek, which translates to slow growing. So Mycobacterium, slow growing bacteria. Quite easy to remember, right? So tuberculosis is mainly transmitted via airborne droplets and occasionally unpasteurized milk and uncooked food. Now, as you can see that I have drawn above, there are 4 different alveoli. The first one is a healthy alveoli. This is what we have on a normal day, on a normal lifestyle. So it is perfect, it's healthy. The second one, however, is, as you can see, has 2 blue circles inside it. So the blue lines engulfing around the blue dots inside. Now the blue lines represent the macrophage and the blue dots inside represent the pathogen, the TB bacteria in this case, that has been engulfed by the macrophage. Now the macrophage will patrol around the human body, so in this case it's patrolling inside the alveoli. So the blue patches inside means that it has been engulfed by the macrophage and destroyed. Now for the third alveoli, it shares a bit of similarity with the second alveoli. But however, it has red dots instead of the blue patches inside it as compared to the second alveoli. Now these red dots represent the TB bacteria that are still alive but still engulfed by the macrophages. So for some reason, the macrophages cannot destroy the TB bacteria inside it. So this is the case. So for the middle 2 alveoli, we label we label them as latent TB. That's what it's called. Now for the fourth one, this is quite distinct from the 3 alveoli before it. So this is active TB. As you can see, there are blue lines. Yes, there are macrophages inside the lung, but there are also a lot of red dots outside the alveoli. This means that it's multiplying very rapidly outside the macrophages. So essentially, this person is being infected heavily with tuberculosis. Now, how do we differentiate a healthy alveoli and someone with latent TB? It's actually the same thing, but the thing is, the first alveoli has yet to be exposed to tuberculosis bacteria, but however, the middle 2 are exposed to TB bacteria, but they are in a dormant state. Now, for active TB, normally it has symptoms, which we will talk about in the next slide. In the case of transmission of TB bacteria via airborne droplets, as we can see here, is indicated by the arrows, which is the direction. Now, when TB bacteria moves out via the airborne droplets out of City's body, it enters Kenny's respiratory system when he breathes in. They are suspended in the air temporarily. Now when Kenny breathes in, right, you can see the 2 pictures. Those are the pictures of the TB bacteria. Kenny breathes them in. Now they enter his respiratory system, and that is how transmission via airborne droplets work. Now for transmission of TB bacteria via unpasteurized milk, by drinking unpasteurized milk that is caused by Mycobacterium bovine. It is a strain of bacteria, TB bacteria, that is present in cows. So bovine, hence the name bovis, for bovine animals. Now when you drink the milk, the bacteria enters your body, and that is how it infects you. Now as you can see, right, so On the image above, it is an X-ray of a lung of a patient with tuberculosis. You can see obvious white patches around it. This indicates that the patient has tuberculosis, and this is how they diagnose with the X-ray. And then for this one, we have a healthy lung. So you can see that compared with the previous one, it's quite normal, it's plain. The lung cavity is quite empty in this X-ray. And what we have here is an illustration of a macrophage engulfing the TB bacteria. Now, to check for tuberculosis as part of a proper diagnosis, the doctor will, first of all, they may conduct blood tests, sputum tests, imaging tests, and as well as injecting tuberculin into your forearm to check for bumps. Now, the most common one is sputum tests, because most of tuberculosis patients produce a lot of sputum. Now, for the cases that when tuberculosis patients do not produce sputum, then we may proceed to blood tests or imaging tests such as a chest X-ray or a CT scan, with the X-ray being done normally. Now, for the treatment, however, it's quite simple. For latent tuberculosis, we just need to take one kind of antibiotic. Now, however, for active TB, it is more complicated, as depending on the strain of the tuberculosis bacteria, they may require treatment by several drugs at once. Now, most of the time, tuberculosis is treated by antibiotics, as it is a bacteria. Side effects of the medication may include nausea or vomiting, loss of appetite, a yellow color to your skin, jaundice, dark urine, and a fever that lasts more than a few days with no obvious cause. Now, the antibiotic medication is split into parts. The first 2 months, you are put on 4 different kinds of antibiotics, and for the remaining 4 months after the first 2 months, you're put on just two kinds of antibiotics. So in total, it's 6 months. After the 6 months, you would go for a test at the doctor. If you are free of tuberculosis, then you may not have to continue taking drugs. But however, if the body still has yet to rid itself of tuberculosis, then drug administration has to be continued. That is all.
I'll be continuing for yesterday's topic, which is diseases. So now I'll be talking about tuberculosis. Okay, so tuberculosis are caused by Mycobacterium tuberculosis and Mycobacterium bovis. So there are a few symptoms, which are acute cough, coughing of blood, sweating, shortness of breath, chest pain, and also fever. So it can be transmitted through airborne droplets, unpasteurized milk, and also eating undercooked food. Okay, there are a few infected countries, which are China, Bangladesh, Thailand, India, and Indonesia. So do you guys understand? Kenny, what are we doing? Understand or not?
Yes.
Sure.
Sure.
Very sure.
Very sure.
Make sure you score A for my subject, or else you come for detention class.
Several days later.
This is not pasteurized food for body. Okay, can make cheese, can make high in protein, high in very good stuff, everything good.
No fat, right?
No, this is fresh. I just wash the box and I use the box. Yeah, you know, cow is very good, milk is very good.
Yeah, very healthy.
You know where you are from, right?
Yeah.
Yeah. Good milk.
Wow, this guy very knowledgeable lah.
Okay, good milk. Okay, thank you. Thank you.
Okay, thank you so much.
Thank you so much. You give me tip 5 ringgit. I talk so much. I need water.
Need your own milk lah.
No more left to go home. I feed children, drink water. Thank you. No change.
Yeah, very nice lah.
A few moments later. Several months later. Later.
Tuberculosis. Okay, so Siti, what seems to be the problem with Siti here?
She got like severe chest pain and consistent fever.
Sitting and coughing blood. Okay. So do you have the handkerchief or anything with the blood specimen on it?
No, I didn't bring.
Okay, so never mind, we can take another test for that. So Siti, we need you to understand that now we suspect that you may be suffering from tuberculosis. Okay? Don't be so astonished. It can be treated. In fact, in where you come from? Are you from Indonesia, right? From where you come from, it's actually quite prevalent, but people don't really know that they have the disease, so that's why they die. But here, we can provide treatment for you because if we notice the symptoms early, we can get you started with some medication. Is that okay? Okay. So, Cindy, just to confirm that you have tuberculosis, we have to. So, just to confirm that you have tuberculosis, we have to take some tests, which will involve us injecting some medication into your body to check for symptoms. Is that okay? Okay. Have you ever had an injection before? Mine is painless, so I need you to pass me your hand. Do you like to win? No. Nurse, Lila! No, City, not Central. City. Oh! Okay, so now, this time, City, I just injected something into you to check for symptoms. So we'll just wait for a while, and meanwhile, we will also have your X-ray taken. Okay?
收电话，小姐。
小姐讲话。
Don't be so 表达嘛。
City. So, City. Now, our nurse here will bring you to the quarantine room. You'll be taken care of inside. Okay? The workers will be in hazmat suits and protective gear at all times. Alright? So do not be afraid of them, they are not robots, okay?
It's okay, it's okay. But I'm scared. Sorry, can I say it's okay?
Can you bring City to the quarantine room?
Okay.
Thank you. I'm leaving now. Don't miss me, it's okay.
So, Mr. and Mrs. Strong, you understand that we have to send a disease control team over to sanitize the house, right? So, we will chlorinate City's room and probably dispose of any belongings. Okay, but if there are any things that we have missed out, please remember to remove them by yourself. Okay? Dispose it by either burning or calling our disease control team. And tell your children to wear masks at home, okay? Alright, so we may arrange the time for the disease control team to go over with our nurse here. Okay, so that's all for now. You guys can head out to the reception. Okay, so here's the
You guys are going to the room, okay? No, no,
Hey,
yeah.
can you, Ruben also.
Hi, good morning. We are disease control staff. We are here to sterilize your house. Can we come in?
Yeah, yeah. I'll be going back. It's okay. We can find another man. Goodbye. Okay. Thank you. Thank you for your hospitality. Remember to come Jakarta and play with me. Okay, okay.
Bye.
Bye-bye. Okay.
Bye.
Bye.
Kenny.
哎，Nobody told me I had a patient. Come boy, what's the problem? Come here, come here, come here. Come on, hurry up. Condition looks bad.
He got like coughing up blood since 2 days ago.
So,
Sweating a lot.
I remember that you have a maid named City, right? Did she finish her medication?
I guess.
You guess. You know that you have to make sure that she finishes that.